Hello, Lynn Watts again, and today I'm going to continue talking about trauma. And in particular, today I'm going to talk about how traumatic situations can affect us as counselors. So often we learn about trauma and are concerned about trauma in the lives of children and the students we work with, but we also have to recognize that as human beings, we as counselors are also certainly affected by traumatic situations, whether that's a current ongoing situation in our own lives or whether it's something from our past or our history. So let's talk about some of the symptoms that can appear for counselors. Of course, some of these as well would show up with other adults. Working with children and perhaps even children. But the first one that I want to mention is that of compassion fatigue. And what that simply means, I think this is pretty much a current idea. I don't recall ever hearing about this many years ago, but compassion fatigue simply means that we no longer are capable of feeling compassionate toward people who are suffering, whether those are students or other adults or whoever we may be working with. And that comes about once we have been under so much stress or so much pressure, so much trauma ourselves, that we lose that ability to be compassionate, to be empathetic, to understand the types of feelings and stress that someone else might be under. So, compassion fatigue is certainly one symptom of traumatic situations. Also, very simple, similar is emotional exhaustion or burnout. And again, this is very much like compassion fatigue, and that as a counselor, you may just feel like you don't care anymore, that you just can't do the job anymore, that you don't have the sensitivity, you don't have the insight, you don't have the energy simply to continue doing what can be, especially in traumatic situations or when you're dealing with students who has undergone trauma. Um, can be an ongoing long-term situation. So if you have experienced trauma and stress yourself, it can certainly activate those kind of feelings, and burnout can be a problem. Obviously, anxiety on your part or irritability is a sign of stress or overabundance of a traumatic situation. Some of the things that we often talk to other students or even adults about, and that are common symptoms, things like insomnia, feeling depressed, feeling overwhelmed, like there's just too much going on and that you as one person can't simply handle it, feeling helpless, feeling that you're completely at a loss in terms of what to suggest or how to help someone. And finally, difficulty with concentrating, focusing, or even making decisions. So, all of these things are things that we often look for in students, but I'm not sure we're always so sensitive to look for them in ourselves. But it's certainly the case that if you have undergone trauma, either in the recent history or even maybe even in your past, that all of these different symptoms can rear their heads and can interfere with your ability to do your job as a counselor. So be aware of those symptoms. Look for them not only in students and in adults that you may be coaching or counseling with, but also in yourself. In the next video, I'm going to talk about some of the strategies that you can use to deal with any of these symptoms and as well as traumatic situations. So thanks for listening.